New at 5, when a loved one goes to the hospital, we hope they get the best care possible.
But nurses at Catholic Health, they claim that short staffing is putting lives at risk. They held a protest today pointing to research that shows the odds of a patient dying go up by 7% for each additional patient a nurse must take on at one time. Senior correspondent Rich Newberg has more about these concerns. Rich?
Jackie and Don, nurses who work for Catholic Health say there is a staffing crisis and are pushing for new state laws that would mandate staffing ratios.
We have no choice but to peacefully assemble for a vigil.
Dozens of Catholic Health nurses held thousands of forms filled out during the past 2 years, documenting what nurses deem to be staff shortages at Catholic Health hospitals.
They fill out a form alerting management that they can't do this assignment safely. They worry about what's going to happen to the patient and that their license might be on the line.
Catholic Health responded by claiming that most of the incident reports don't pan out and charged that the rally was politically motivated over contract negotiations at Sisters Hospital's St. Joseph's campus. But the union sees it differently.
On staffing issues, we don't have a productive dialogue, and that's what we're looking for.
Catholic Health says the union has not proposed any feasible solutions and claims the union has refused to bargain as needed and failed to respond to many of the hospital's proposals. But nurses say many times they are overwhelmed by having to care for too many patients.
I put in 17 hours that day.
How did you feel at the end of the day?
I felt exhausted, and I felt like I was not at my mental capability that I was when I started the shift.
Safe staffing legislation has never made it to the floor of the Senate or the Assembly in New York for a vote.
And that's why I'm calling upon the governor to call a special session next week when legislators are in Albany so that we can pass this bill now.
The form submitted by these nurses captured the frantic pace of their shift.
Nurses at Catholic Health say staff shortages lead to some of them being placed in areas outside of their expertise. Catholic Health says the rally did not move the bargaining process forward. The nurses say the rally was not politically motivated. Reporting live, Rich Newberg, News 4 at 5.